It's a symbol of hope and healing in every community. But for some families in Hemet, this hospital is now also a symbol of fear.
There's a lot of people here that need this hospital, especially maternity.
Hemet Global Medical Center just announced to its employees it will be shutting down its labor and delivery department.
I've been here for 44 years. I've dedicated my entire career to working here, and it breaks my heart.
Jenny Packham is a labor and delivery nurse at the hospital and one of 35 people losing their jobs. But she says her fear is for the women of this community.
Many of them are underserved. They don't get prenatal care.
A sentiment echoed by her fellow nurses who met us outside the hospital with a council member from nearby San Jacinto, all hoping to rally support to stop the closure.
I don't believe anything is too late because they haven't closed it.
My concern overall is for especially the low-income community that we have here.
These women say most of their patients are low income and underserved, so they lack prenatal care. And when it comes time to deliver, they need nurses trained in how to help.
They just come here when it's time to have their babies, and those can be very high-risk pregnancies.
Because when the babies are preemie, like, time is their brain. I mean, they lose brain, like, after their brain cells if we're not oxygenating them.
There are 3 hospitals around 20 miles away, but with 2-lane roads, that's a 45-minute drive.
And they'll tell me it's so heartbreaking. I didn't have gas to go over there. I know this, but I didn't have gas money.
The hospital tells us they are shuttering the department at the end of October because of low birth numbers and a shortage of physicians, something these nurses admit is true. But they argue it should still stay open for every mother and every baby deserves the very best care.
If a mother doesn't have access to health care here close by and transportation affects them from going to Loma Linda, that baby's going to come, and that baby's going to get delivered somewhere. And it could be delivered in an alley somewhere. It could be delivered in a trash can.
The hospital says women in need can still come here and give birth in the ER. As for the employees, we are told that they will be offered positions somewhere within the system. From Hemet, I'm Joy Benedict, KCAL News.